Struggling with diastasis recti after pregnancy? Here's what you need to know before considering surgery. If you've been dealing with that post-pregnancy tummy bulge that just won't go away, you might be facing a condition called diastasis recti. Many women experience this issue, and for some, surgery might be the best option. But what exactly can you expect from diastasis recti surgery? Hello, I'm Dr. Daniel. In this video, I'm going to talk about what diastasis recti surgery is, how it can help, and what you can expect if you decide to go through with it. Let's dive in. First, let's quickly recap what diastasis recti actually is. During pregnancy, your growing baby pushes your abdominal muscles apart. Normally, these muscles come back together after childbirth, but for some months, they don't fully return to their original position. Also, this condition can occur to men, in which their muscles get separated for a different reason. This separation in the abdominal muscles can cause that stubborn belly bulge, poor posture, back pain, and even pelvic floor problems. Surgery can be considered when exercises alone don't help or when the gap is too large. Now, the big question is, when should you consider surgery? As for many other conditions, surgery is not the first-line treatment and should be reserved for those cases in which a specific physiotherapy was not enough. Not every physiotherapist is an expert in reinforcing this area after pregnancy. Be sure you are getting an expert treatment. However, for some cases, mainly if the remaining gap is larger than 3 cm and is causing symptoms, surgery can be a great option. Let's talk about what happens once you've decided to consult with a surgeon. During your consultation, we will assess you with the extent of your muscle separation, review your medical history, and determine whether surgery is the best option for you or not. Be prepared to discuss any symptom you are experiencing, from lower back pain to urinary incontinence, as this helps us to understand how the surgery can benefit you. You might also need to undergo some tests, such as an ultrasound, to measure the severity of the separation. This is important because it helps us to plan the procedure. You'll also get detailed instructions on what to do in the weeks leading up to surgery. Things like avoiding certain medications, following a specific diet, and arranging for postoperative help at home. So what's the surgery like? Well, first of all, you need to know that I do not perform the typical abdominoplasty or tummy tuck. The technique that I use is the keyhole abdominoplasty. I don't think there are many surgeons making this in Dubai, and has several advantages compared to tummy tuck. Instead of a long horizontal incision that leaves a huge scar, I only do 3 incisions of 1 cm each. Instead of relocating the belly button in a new area with this ring scar you have probably seen before, belly button is not touched, and recovery is almost painless, as the most sensitive area, skin, has barely been touched. It also has one disadvantage though: I do not remove excessive skin. But remember, the primary goal for this surgery is functional. It's about giving your core muscles the support they need and getting you back to feeling strong and healthy. Recovery is a huge part of the process, and it's important to know what to expect. You will go home with 1 or 2 drains, which are fine plastic tubes connected to a collector device. These will be removed after 3 to 7 days in my office. For the first few days, you'll feel some tightness and numbness in your abdomen, and most patients feel well enough to move around within a week, although you will need to avoid heavy lifting and strenuous activity for at least 6 weeks after surgery. You'll also need to wear a compression garment during the healing process. This helps reduce swelling and supports your muscles as they heal. We will give you a specific guideline about when you can return to normal activities, and trust me, it's important to follow these instructions carefully to ensure the best outcome. One of the best parts about diastasis recti surgery is the long-term benefits. Not only will you likely see a flatter, more toned abdomen, but you'll also experience improved core strength, better posture, and relief from any associated pain or discomfort. This surgery can truly be life-changing, helping you regain confidence and physical well-being. If you are considering diastasis recti surgery, be sure to consult with us to discuss your options and determine whether this is the best for your situation. Thank you for watching, and I hope this video has been helpful in guiding you through the process.